Namaste, I am Dr. Jessie John, Assistant Professor, Department of Anatomy, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH Women University. Today we will discuss the osteology part of the anatomy. This is the femur, the only bone present in thigh. It is longest and strongest bone of our body. It is divided into three parts. This is the proximal part and distal part, and in between of these part there is a shaft. It is long, typical bone. Now we will see the some feature of the proximal part here. This is the head, this is neck and bony prominence. This is the greater trochanter, this is the lesser trochanter. Head is rounded and has a smooth surface. It articulates with the acetabulum of hip bone here. And form the hip joint. This articular surface is covered by the articular cartilage. Except a depression, this is called fovea. This is the neck. It has two surfaces, anterior and posterior surface, and two borders. This is the superior border, this is horizontal, and this is the inferior border, that is oblique inline. There are two bony prominence. It is large, so it is called greater trochanter. This is quadrangular in shape. This is the small conical shape bony eminence. This is called lesser trochanter. Greater trochanter, we can see here, it has a upper border here and three surfaces. This is the lateral surface and this is the anterior surface. Inside here, this is the medial surface. There is a fossa here. This fossa is called trochanteric fossa. Now we will see anteriorly in between of greater trochanter and lesser trochanter. There is line. This line is called intertrochanteric line. And when we see the posterior line, we see a crystal-like structure in between of this trochanter. This is called intertrochanteric crest. In middle of this, there is a tubercle. This tubercle is called quadrate tubercle. Intertrochanteric line extended downward as a spiral line, and lateral to this there is a roughened ridge. This roughened ridge is called gluteal tubosity. This is the shaft. The shaft is divided into three parts: upper 1/3, middle 1/3 and lower 1/3 part. We can see a roughened ridge-like structure on the posterior part of the shaft. This is called linea aspera, and it has two lips. One is medial lip and another is lateral lip that diverge in upper part and as well as in lower part. First we will see the upper 1/3 part of the shaft. It has four borders and four surfaces. This is the medial border and this is the lateral border. Medial and lateral border is rounded and ill-defined. Posteriorly we see the both lips of the linea aspera diverse and encloses its surface, additional surface. This is called posterior surface. So there are four border. This is the medial border and lateral border and the spiral lines of the linea spera and gluteal tuberosity and four surfaces. The surface present in between the spiral line and the medial border, this is called medial surface, and the surface present at the lateral margin of the gluteal tuberosity and lateral border, this is called lateral surface, and the surface present in between the medial border of the lateral border, this is called anterior surface. This surface is smooth, rounded and convex, and the posterior surface present the spiral line and medial margin of gluteal tuberosity. So there are four borders, four surfaces in the upper 1/3 part of the shaft. Now we will see the middle part of the shaft. There are three borders, three surfaces. This is the medial border and this is the lateral border, and here we can see the posterior border as linea spera and three surfaces that present the linea spera and the medial border. This is called medial surface, and the surface present in between the linea spera and the posterior border, this is called lateral border, this is called lateral surface, and the surface present between the medial border and the lateral border, this is called anterior surface. So this part, the middle part of the shaft, has three border, three surfaces. Now we will see the lower part of the shaft. This is the lower part of the shaft, 1/3 part of the shaft. It has four surfaces, four border. So again, this is the medial border and this is the lateral border, and here the both lips of the linea spera diverge and continues at the supracondylar line. This is the medial supracondylar line, and here you can see this is the lateral supracondylar line. These supracondylar lines encloses a surface. This additional surface is called popliteal surface. So there are four borders: medial border, lateral border, and medial supracondylar line and lateral supracondylar line. The surfaces that present in between the medial border and the medial supracondylar line, this is the medial surface, and the surface present in between the lateral supracondylar line and the lateral border, this is called lateral surface, and the surface present in between the supracondylar line, this is the popliteal surface as the posterior surface, and here we can see the anterior surface that present the medial border and the lateral border. So we can see that here all medial surface and the lateral surface facing posteriorly more. So all the parts has the medial surface and the lateral surface, they are facing more posteriorly. Now we will study the distal part of the femur. There are two condyles. Medially situated condyle is called medial condyle, and laterally situated condyle is called lateral condyle. They articulate with the medial and lateral condyle of the tibia and form the important part of the knee joint. In posteriorly we can see here there is a fossa in between of these condyles here. So this fossa is called intercondylar fossa. In this intercondylar fossa, the intercondylar tubercle or the intercondylar eminence of the tibia rests here while they are forming the knee joint. So here we can see the articular surface. You can see here this articular smooth surface. So there is the anterior articular surface. Here it articulates with the patella, and this articular surface is called patellar articular surface. And inferiorly and posteriorly you can see the smooth articular area. This is called tibial articular surface, where it articulates with the tibia. In the sides of the condyles, this is the non-articular surface. There is a bony eminence. This is called epicondyle. So superior to this epicondyle on the medial condyle here, this is called adductor tubercle. You can see this is the adductor tubercle. And here this is the lateral epicondyle. This bony eminence is called lateral epicondyle, and below this lateral epicondyle here you can see the groove. This groove is called popliteal groove. So we have studied the all parts of the femur here. We have studied the upper part or the proximal part, and we have studied the features of the distal part and the shaft. Now we will see the side determination of the femur. So every time you should hold the femur in such a manner that this head directed towards the medially, and intercondylar fossa and linea aspera, one of these, either linea aspera, either intercondylar fossa, should face posteriorly. So I am placing this femur like this. I am facing here this medially directed, and intercondylar fossa or the linea aspera face posteriorly. So this femur belongs to the right leg. So this is the femur of the right leg. So this is all about the femur, and we have studied here the general features and the side determination of the bone femur.